Today, I'm thrilled to announce my plan to lower healthcare prices for all Americans and truly make healthcare affordable again. We're doing things that nobody's ever been able to do. We're calling it the Great Healthcare Plan. Instead of putting the needs of big corporations and special interests first, our plan finally puts you first and puts more money in your pocket. The government is going to pay the money directly to you. It goes to you, and then you take the money and buy your own health care. Nobody's ever heard of that before, and that's the way it is. The big insurance companies lose, and the people of our country win. This proposal locks in the massive discounts on prescription drugs that my administration is achieving through our most favored nation drug pricing agreement. Now, when you hear about that, for 40 years they've been trying to do it, but they never were able to do it. No other president was able to do it. I got every other country to approve it by the use of tariffs and other things. They all approved it. Nobody else got it. No other president got it. And for the most part, they didn't even try because they felt it was impossible. It'll bring down drug prices 80, 90%, in some cases, just numbers that nobody's ever heard of before. Your prescription drugs will come way, way down. And under this policy, the prices of many drugs will be slashed by 300, 400, and even 500% starting this month at the TrumpRx.gov. So instead of Americans paying the highest drug prices in the world, which we have for decades, we will now be paying the lowest cost paid by any other nation. So any other nation that's paying the lowest cost, that's what we're going to pay. And the American people will get the savings. So I have to reiterate, the lowest price in the world is what you're going to pay. Before, you were paying the highest price in the world by far, and the politicians did nothing about it. So I'm asking Congress to complete the work that we've started. Next, my plan would reduce your insurance premiums by stopping government payoffs to big insurance companies and sending that money directly to the people. Obamacare was designed to make insurance companies rich. I call it the Unaffordable Care Act, with billions of dollars in taxpayer subsidies that helped their stock prices skyrocket over 1,700%. As you paid more money for health care every single year, more and more. The premiums went higher and higher. I want to end this flagrant scam and put extra money straight into the healthcare savings account in your name, and you go out and buy your own healthcare, and you'll make a great deal. You get better healthcare for less money. That way you can choose the care that is right for your family. To further reduce insurance premiums, my plan ends the giant kickbacks to insurance brokers and corporate middlemen that only drive up the costs, and that's what they're intended to do, drive up the cost. But we're driving down the costs. And it fully funds a long neglected part of the law known as the Cost Sharing Reduction Program. This measure alone should cut premiums on the most popular Obamacare plans. It's hard to believe there are any, because it's a hated program. It's unaffordable, but it's going to cut them by an average of 10 to 15%. Next, the Great Healthcare Plan. That's the name. It's called the Great Healthcare because it's great healthcare at a lower price. Mandates unprecedented accountability and transparency from insurance companies and all healthcare providers so that special interests can no longer profiteer at your expense. As the saying goes, sunlight is the best disinfectant. That is why my plan orders all insurance companies to publish rate and coverage comparisons in very plain English. It requires insurers to publish detailed information about how much of your money they're going to be paying out in claims versus how much they're taking in profits. In other words, you will be able to watch the scam. It forces them to release detailed data on how many claims are being denied and whether those denials are eventually overturned on appeal. And most importantly, it will require any hospital or insurer who accepts Medicare or Medicaid to prominently post all prices at their place of business so that you are never surprised and you can easily shop for a better deal or better care. And you're going to end up doing both. You're going to get a better deal and better care. We will have maximum price transparency and costs will come down incredibly. I'm calling on Congress to pass this framework into law without delay. Have to do it right now so that we can get immediate relief to the American people, the people I love. Thank you very much.
Imagine if, instead of navigating complicated bills and insurance hoops, seniors received direct healthcare payments straight to their pockets. It sounds almost too good to be true, but that's exactly what's being promised with Trump's Great Healthcare Plan. This bold proposal is stirring up conversations across the country, and the big question on everyone's mind is, could seniors actually benefit from direct healthcare payments? In today's video, we're breaking down the details of this ambitious plan. What does it mean for seniors struggling with skyrocketing medical costs? How would these direct payments work in practice? And what impact could this have on the current healthcare system that so many rely on? We'll cut through the political noise and deliver the facts you need to understand how this plan could reshape healthcare for older Americans. Whether you're a senior, a caregiver, or just someone interested in the future of healthcare, this video will help you grasp the potential opportunities and challenges that lie ahead. You won't want to miss the insider insights and expert analysis that could affect millions of lives. If you want to stay informed about how Trump's healthcare vision might change things for seniors and families, hit that like button right now. Your support helps us keep bringing you clear, trustworthy updates on topics that matter most to you. When it comes to healthcare, seniors face some of the most significant challenges. The rising cost of prescriptions, doctor visits, and hospital stays often leaves many older Americans worried about how they'll afford the care they need. So when a plan like Trump's Great Healthcare Plan surfaces, promising direct healthcare payments to seniors, it naturally grabs attention and raises a lot of questions. What does this really mean? How would it work? And more importantly, could it actually deliver on its promises? To start, the idea behind direct healthcare payments is straightforward. Rather than seniors having to rely solely on insurance companies or government programs to cover their medical expenses, they would receive funds directly to help pay for their care. The goal is to give seniors more control over their healthcare dollars, enabling them to decide how to best spend that money based on their unique needs. It sounds empowering, but implementing such a plan is far from simple. One of the major appeals of this approach is the promise of reducing bureaucracy. Many seniors spend hours dealing with complicated insurance paperwork, denied claims, and confusing coverage limits. Direct payments could, in theory, cut through much of that red tape, providing funds quickly and without the usual delays. But this also means there needs to be a clear system in place to determine who qualifies, how much money they receive, and what kind of accountability exists to ensure the funds are used effectively. Another important aspect to consider is how this plan fits into the existing healthcare framework. The current system is a complex web of private insurers, Medicare, Medicaid, and supplemental programs. Introducing direct payments would require coordinating or even overhauling parts of these systems to avoid overlap or gaps in coverage. The plan also raises questions about funding sources. Where would the money for these payments come from? Would this be funded by federal taxes, redirected existing budgets, or new financial mechanisms? Many experts are divided. Supporters argue that direct payments could lead to more personalized care, giving seniors the freedom to choose providers, treatments, or even wellness programs that best suit them. They see it as a step toward a more consumer-focused healthcare model, one that prioritizes patient choice and flexibility. Critics, however, caution that without strict oversight, direct payments could be misused, or that some seniors might struggle to manage large sums of money for healthcare, leading to potential financial vulnerability. The plan also sparks debate about its potential impact on insurance companies. If seniors receive direct payments, would they still need traditional insurance? How would insurers adjust their offerings? Some worry this could disrupt existing insurance markets or lead to higher premiums for those not receiving payments. Balancing these changes requires careful policy crafting and stakeholder cooperation. A critical element to watch is how the plan addresses the most vulnerable seniors, those with chronic illnesses or disabilities who often require extensive and costly care. Would direct payments be sufficient for these individuals, or would additional support programs remain necessary? Ensuring that these seniors don't fall through the cracks is essential to any healthcare reform. Politically, the Great Healthcare Plan is a bold move. Healthcare is a deeply personal and often polarizing topic, and proposing significant changes always invites scrutiny. Advocates of the plan emphasize the potential benefits for seniors, but opponents worry about implementation challenges and unintended consequences. Understanding these perspectives is key to evaluating the plan's feasibility. From the perspective of seniors and their families, the prospect of receiving direct healthcare payments could be a game changer. For many, managing healthcare expenses is a constant source of stress. Having extra funds dedicated specifically to medical needs might ease this burden and improve quality of life. However, it's also natural for beneficiaries to want clarity on how these payments will work in real life, what documentation is needed, how to access the funds, and what protections exist against fraud or misuse. Education and support will be vital. Rolling out such a program requires clear communication to seniors about their options, eligibility, and responsibilities. Navigating healthcare is already complex, and adding a new payment system must come with user-friendly guidance and accessible resources to help seniors make informed decisions. Looking at similar programs internationally or in pilot states can offer valuable lessons. Some countries have experimented with direct healthcare payments or vouchers with mixed results, highlighting the importance of careful program design, ongoing evaluation, and flexibility to adapt to challenges. Additionally, the role of caregivers and families cannot be overlooked. Many seniors rely on loved ones to help manage their health and finances. Direct payments could empower caregivers to better assist, but it also raises questions about oversight and ensuring funds are used appropriately. Establishing safeguards that protect seniors while allowing flexibility will be a delicate balance. Healthcare technology also plays a role in this vision. Digital payment platforms, mobile apps, and online portals could simplify access to direct payments, track spending, and offer real-time support. However, technology adoption varies widely among seniors, so solutions must be inclusive and designed with accessibility in mind. Furthermore, the broader economic impact of such a plan is worth considering. Direct healthcare payments could increase consumer spending in the healthcare sector, potentially driving demand for services and innovation. On the flip side, the government or private sector funding these payments would need to account for budget impacts and sustainability. One question that often comes up is how this plan might affect Medicare, which currently provides coverage to most seniors. Would direct payments replace parts of Medicare, supplement it, or operate independently? Understanding these interactions is crucial, as Medicare has long been a cornerstone of senior healthcare. Insurance experts also raise points about risk pooling. Traditional insurance relies on spreading risk among many individuals, whereas direct payments put more responsibility on each senior. This shift could have implications for risk management and financial protections. From a policy standpoint, transparency and accountability will be central. Stakeholders will want to see clear reporting on how funds are allocated and used, outcomes achieved, and adjustments made over time to improve effectiveness. This level of oversight builds trust and helps refine the program. It's also worth exploring how this plan fits into broader healthcare reform efforts. The United States continues to grapple with rising costs, uneven access, and quality disparities. Could direct payments to seniors be a stepping stone toward larger changes? Or might they complicate an already fragmented system? For seniors themselves, the key will be how the plan translates into day-to-day realities. Will they see faster access to care? More choices in providers? Reduced paperwork? These are the factors that ultimately determine success. To prepare for potential changes, seniors and their families should stay informed by following official announcements, consulting healthcare professionals, and exploring their current benefit options. Being proactive can help smooth transitions and maximize benefits. It's also important to engage with community organizations that support seniors. These groups often provide education, advocacy, and assistance navigating healthcare changes, making them valuable allies. The media plays a crucial role too, offering balanced coverage that highlights both the promise and challenges of Trump's great healthcare plan. Critical thinking and seeking information from trusted sources will help viewers make sense of complex policy shifts. Throughout this discussion, the human element remains at the heart. Behind every policy are real people, seniors hoping for relief, families seeking stability, healthcare workers striving to provide quality care. Keeping their voices central ensures that reforms stay focused on improving lives. As the plan progresses, public feedback and political negotiations will shape its final form. Citizens can influence outcomes by staying engaged, contacting representatives, and participating in discussions. The idea of direct healthcare payments to seniors represents a bold attempt to shift the traditional healthcare landscape. It challenges decades of systems built around insurance companies and government programs like Medicare. While the concept has potential, it also demands a new way of thinking about healthcare funding and delivery. For many seniors, this could mean unprecedented freedom and flexibility, but it also means they must become savvy consumers of their own healthcare dollars. Education will be the cornerstone of success. Seniors will need clear, accessible information to understand how much money they can expect, how to use it wisely, and what safeguards are in place to protect them. Community centers, healthcare providers, and senior advocacy groups will play a vital role in bridging the knowledge gap. Programs that offer personalized support can empower seniors to make the best choices for their health without fear of being overwhelmed by complexity. At the same time, policymakers must ensure that this new model does not widen disparities. Healthcare access and literacy vary widely among seniors based on geography, income, education, and other factors. Direct payments could enhance care for some, but inadvertently leave behind others who lack resources or support. Targeted outreach and supplemental programs will be essential to provide an equitable healthcare future. Financial oversight is another critical element. As funds flow directly to seniors, mechanisms must be in place to monitor appropriate use while respecting autonomy. Fraud prevention and assistance for those struggling with financial management will help protect beneficiaries. Technology, when implemented thoughtfully, can aid in tracking and transparency, but it must be paired with human support. Healthcare providers will also need to adapt. With seniors potentially managing their own healthcare budgets, providers may face changes in payment models and patient expectations. Flexibility and innovation in care delivery could be necessary to meet evolving demands. From a broader perspective, the plan raises questions about sustainability. The source of funding for direct payments, whether through federal budgets, taxes, or reallocations, must be carefully balanced to avoid unintended economic consequences. Long-term planning will be essential to maintain the program's viability while continuing to improve senior health outcomes. It's important to acknowledge the political dimension as well. Healthcare reforms often become entangled in partisan debates, and the Great Healthcare Plan is no exception. Its success depends on bipartisan cooperation, public trust, and transparent communication. Building consensus around such a transformative proposal will require addressing concerns openly and adapting to feedback. For seniors watching this unfold, the future may feel uncertain but also hopeful. An extra financial boost dedicated to healthcare could ease daily struggles and provide peace of mind. It could mean better access to medications, treatments, or even preventive care that delays costly interventions down the line. By placing funds directly in the hands of those who need them most, the plan aims to humanize and simplify healthcare. Still, the journey from proposal to reality will involve hurdles. Implementation challenges, logistical complexities, and unforeseen obstacles will need nimble problem-solving. Listening to seniors' experiences and continuously refining the program will be key to ensuring it delivers on its promise. As you think about what this means for you or your loved ones, remember that knowledge is power. Stay connected to official updates, reach out to healthcare professionals for advice, and engage with community resources. Planning ahead can help you navigate changes smoothly and make the most of new opportunities. In summary, Trump's Great Healthcare Plan, and the prospect of direct healthcare payments offer a fresh vision for senior care, one centered on choice, flexibility, and financial empowerment. It represents a potential shift toward a more personalized, less bureaucratic healthcare experience for millions of Americans. While questions remain and the details continue to evolve, the conversation sparked by this plan is crucial. It challenges us to rethink how we support seniors in accessing quality care and managing health expenses. It invites policymakers, healthcare providers, families, and seniors themselves to participate in shaping a more responsive system. Ultimately, the success of this initiative will be measured by its impact on people's lives. Will seniors feel more secure and in control of their healthcare? Will families experience less stress and financial strain? Will the healthcare system become more efficient and patient-focused? These are the outcomes we all hope to see. Thank you for joining us today to explore this important topic. If you found this video helpful and want to stay updated on the latest healthcare news affecting seniors, please give it a thumbs up and subscribe to the channel. Your support allows us to keep delivering clear, timely, and trustworthy information. Together, we can stay informed, advocate for better healthcare, and ensure that seniors receive the care and respect they deserve. Here's to a future where healthcare truly serves those who need it most.